Many nurses leave the profession to have a family, and those who are out of practice for 5 years must complete an approved re-entry to practice program. Queensland does not have such a program at present. Given that the health departments of the ACT, the Northern Territory, South Australia, Tasmania and Victoria provide re-entry to practice programs for nurses, some of them for free, what is your position or strategy regarding the Queensland Government providing such programs for Queensland nurses? Aidan.
Yep, well, Jamie has a very good point that I think obviously then the first point we go is to look at the different models in the ACT, the Northern Territory, Tasmania, Victoria, and of course we could probably even get one up on them and actually refine if there are any loopholes or anything that can be improved. So clearly I think that's something that a lot of people who go on to maternity leave and then decide to get back in the workforce can find it very, very hard. So the least amount of hurdles that we can put on them as practical would be obviously certainly the way we should go. But I think also in that time, if they leave for the period of 5 years that Jamie suggests, there should be not only the refresher courses, but there should be avenues whereby they can actually accrue a minimal amount of time that they can with their work and family balance, so that the refresher course doesn't need to be done in all one hit. Rather, they keep that refresher course going throughout the time they've had off. So there should be a variety of models that best suits the situation that they're in with their family to ensure that there's a smooth transition when they decide to go back into the workforce.
Thank you very much.
Queensland Health and the QNU have for some time been developing working together and contributing their views in developing a nursing and midwifery workforce plan. And that it needs to include, and it's probably taken longer than what it ought to, and that said, it will take less time should I have the opportunity to get my hands around the throat of that exercise, if I can be blunt. That plan ought to be addressing issues like was raised with Helen, a 60-year-old nurse who is not saying she doesn't want to work. She's saying she doesn't want to work on night shift, and that's not an issue of an ageing workforce. There's a bigger collective issue of an ageing workforce, but this is a person who wants to keep working, but have more suitable working circumstances for her age. So that ought to be picked up in the plan. The other thing, then coming to Jamie's question about re-entry program, we invest so much into training nurses and midwives in the first place. I mean, it's the best human capital you can think of, aside next to teachers, I would say, frankly. And then for us not to maximise the opportunity for people who want to come back into the workforce to be refreshed in their skills and re-enter, and start resuming the pursuit of their profession. I think it's it's absolutely vital that we do that. So I am 100% behind looking at ways in which we can re-engage presently disengaged nursing and midwifery staff to encourage them to come back into the workforce. That needs to be part of the 5-year, 10-year workforce planning strategy, because the numbers will be there that will tell us. And there'll be different strategies needed for different people in different circumstances who are presently, as they say in the blue-collar industry, working out of the calling, but who want to come back into the calling. So we just need to be mindful that there'll be a variety of different circumstances for people, and craft the re-entry options to maximise the opportunity for people in diverse circumstances to re-enter the workforce.
Sorry. Sorry.
New way of cutting him off.
That's right. Mark.
I was contacted by a nurse here in Queensland about 12 months ago, and she had left the profession or occupation to have a family, and she couldn't get any re-entry courses or studies or whatever to gain entry back into Queensland as a nurse. She had to travel to Victoria to do the course, if I recall correctly. And that took her away from her family, her children, her husband, not just once, but on a couple of occasions. So the cost involved in that alone was significant, not just in the dollar terms, but also in the fact that her family was without her for a period of time. I think that if we have a nurse or a midwife who undertakes the degree of study required to achieve the qualifications in either or both, and that person then leaves the workforce, there is no reason why we should not have a course here in Queensland allowing that person to come back in. Because as we know, as we progress in our profession, it's not just the clinical knowledge that we gain, or you gain as the case may be, it's so many other things of a corporate knowledge base that don't come with an immediate graduate. And I think by putting in place a system whereby someone who leaves the profession wants to come back in right here in Queensland, gains the qualifications to do so, we gain so much more. And I think it is an excellent idea, and it's an idea that we would certainly encourage at a time when such nurses are leaving in such numbers at this point in time. If we can attract them back in by applying or allowing them to apply for this form of study and then get them back into the Queensland Health workforce, it's a win-win scenario. You simply, in corporate Australia, you don't throw away good knowledge. So we should be going out there and chasing that knowledge and trying to get them back into into Queensland Health in our public health system. I think it's a fantastic idea.
Thank you. Adam.
I must confess I was actually still sitting here musing on preventive health and didn't listen to the question. Can you run it by me?
I certainly can. It was about nurses leaving the profession to have families, and after 5 years you've got to do a re-entry program. There is no re-entry program in Queensland, but there is in other states. So do you have any comments about that?
My understanding was that there was re-entry qualifications that could be got through the private sector by paying it, are they not?
Not in Queensland.
Only elsewhere. Yeah, right. Yeah, well, I guess obviously if you lose a very experienced worker from the workforce, then you've lost even more than somebody who's come in fresh and doesn't have so many runs on the board and so much experience. So it's an even greater loss, and there are even more costs associated ultimately with trying to get somebody to a point where they can offer the workforce that same level of skills and knowledge and experience. So absolutely, I think a course like that should be offered in Queensland to get those workers back into the workforce. I guess then the difficult questions come up about who pays for it and where the money comes from. And you know, I'd be kind of interested in engaging on the detail of that and how that would work. We've sort of been holding ourselves to a bit of a strict discipline of sort of not making wild promises that we can't fund. So I guess I'd want to know more about the detail of how that would work before saying anything firmer about it, aside from I can see the merit in it. I'm very receptive to the idea.
Thank you. That's great.